RFK Jr. considers removing all members from key U.S. Health Advisory Panel. What you need to know. In a surprising move that has raised eyebrows across the political spectrum, Health and Human Services, HHS, Secretary Robert F. Kennedy Jr. announced on Monday that he is contemplating the removal of all members from a key advisory committee responsible for guiding preventive health services. This committee, known as the U.S. Preventive Services Task Force, is made up of medical professionals who volunteer their time for 4-year terms. Appointed by the HHS Secretary, these experts are intended to operate free from political pressures, ensuring that their recommendations are based solely on scientific evidence. The task force meticulously analyzes extensive scientific data to provide recommendations on various health services, including cancer screenings and medications for HIV prevention. Their findings are categorized using a grading system, and under the Affordable Care Act, commonly referred to as Obamacare, insurance companies are mandated to cover services that receive an A or B grade from the task force at no cost to patients. This is crucial for ensuring that essential health services are accessible to the public. However, a recent report from the Wall Street Journal indicated that Kennedy is considering dismissing the task force members, labeling them as excessively woke. This characterization has sparked significant debate about the role of political ideology in health recommendations. During a press conference focused on the Supplemental Nutrition Assistance Program, SNAP, Kennedy did not shy away from acknowledging that the potential removal of task force members is indeed under review. He expressed concerns about the task force's performance, stating, "The task force has done very little over the past 5 years. And we want to ensure it is effectively approving interventions that will genuinely prevent the health decline of the American public. And it hasn't. We're evaluating the personnel and making decisions, but nothing has been finalized yet." Adding to the tension, Kennedy's office unexpectedly postponed the task force's July meeting, causing alarm among some Democrats and public health advocates who fear that this could hinder vital health initiatives. This discussion about potentially overhauling the task force follows a recent Supreme Court ruling that affirmed Kennedy's authority to appoint and dismiss panelists at his discretion, as well as to possibly delay or reject their recommendations. An unprecedented move in the history of this advisory body. This situation raises important questions about the intersection of health policy and political influence. Are we witnessing a shift in how health recommendations are made? And what implications could this have for public health? As this story unfolds, it invites a broader conversation about the balance between scientific integrity and political agendas in healthcare. What are your thoughts on this controversial issue? Do you believe that political considerations should play a role in health advisory committees? Share your opinions in the comments.